Hello and welcome to Empowered Health. We have another great show packed with useful information to help you empower your health.
We will be revisiting our recurring segments on eye and dental health, and later in the show, we have some more gluten-free baking with Chef Julia Alton.
But before we get to that, we're going to meet John Stoddart, a man who swears by a unique and powerful form of massage called Rolfing.
John Stoddart was in chronic pain for the better part of 20 years, and he didn't know why. Then a diagnosis revealed the cause: Lyme disease.
With my disease or illness response to the pain, I tend to kind of collapse into the pain. It's in my neck, it's in my shoulders, it's in my back. And that, over time, creates a kind of pattern, a physiological pattern. That has an impact on how I feel, how I breathe, how I think.
John tried several mainstream and alternative approaches, but nothing seemed to click with him.
I've known about Rolfing for years. My body wasn't quite ready with the impact of Lyme to go into something quite as intense as Rolfing. But at this stage in my treatment plan, I thought I might be ready for it. I knew Barry. And so we decided to give it a try, and my body responded really well.
Rolfing it's a process. We address the whole body, so although we can treat individual issues like whiplashes or knee pain, etc., generally our focus is to rebuild the whole body. And it's in that rebalanced state that the whiplash and the knee pain, etc., just resolves itself.
Rolfing works over a series of 10 treatments, addressing the body as a whole. It's often likened to a deep tissue massage, but there's a little bit more to it than that.
Classic massage using oil has more of an effect on the fluid of the body, relaxing the nervous system, cleaning out the muscles, where the Rolfing is grabbing a hold. We don't use oil as such, and we grab a hold of the tissue and we get to stretch it free. Adhesions and old patterns that have settled in the body that compromise optimum function. And so that's what we do, is use fingers, knuckles, elbows to free the tissue up. With the idea, what we're after is having the client move in a new way, stand in a new way, sit in a new way, such that that new way of moving is what self-maintains their body.
John has completed the full 10 sessions and feels a tremendous difference.
The pain has been reduced, which is a remarkable thing. So it's allowed me to be able to take on a higher degree of physical exercise that I wasn't able to do before.
John's Lyme disease treatment plan continues to evolve, and he believes that Rolfing has played an important part in finding out what works for him.
I would say that yes, my life has definitely improved. Yeah.
Coming up on Empowered Health.
Scientists have been undecided about the effectiveness of vitamin supplements pretty much since they were able to isolate them from our food. Now, they've had decades to prove that supplements work, and for the most part, they've failed.
You're watching Empowered Health. Michelle, I don't know if you take supplements, but I find the whole world of supplements to be quite overwhelming. I mean, what should you take? What actually works?
I'm with you, VJ. There's actually a lot to know, and to get us started, Randy Shore is back. Randy?
Scientists have been undecided about the effectiveness of vitamin supplements pretty much since they were able to isolate them from our food. Now, they've had decades to prove that supplements work, and for the most part, they've failed. Vitamin C is one of the most widely used supplements because of its supposed ability to shorten the common cold. It doesn't. A recent analysis of 29 trials involving 11,000 people concluded that vitamin C does not reduce the incidence of colds, and it has no effect on the duration of a cold when you take it after the onset of symptoms. In fact, the results are all over the map, due in part to the fact that there is no one common cold. The cold is really dozens of viruses. I know that if you're a vitamin C believer, nothing I say is going to change that. I'm okay with that. Now, vitamin E was the darling of the health and supplements world. It's supposed to prevent heart disease, enhance virility, protect you from Alzheimer's? It doesn't. A massive 4.5-year study involving 10,000 people found that people taking vitamin E were no less likely to have a coronary event than people who weren't. Ditto for Alzheimer's. Large, well-designed studies find that mega doses of vitamin E have no effect on your risk of Alzheimer's. As for natural male enhancement, you might as well order those crazy pills on the internet. But I don't think you should. One effect that does pop up regularly in vitamin E studies is an increased risk of death. So think about that. Vitamin D, the sunshine vitamin, may be the only vitamin that you need in doses higher than you'll get from food. Health Canada has recently increased its daily recommended intake of vitamin D, and it is higher than you'd ordinarily get from food. Now, vitamin D does seem to reduce the risk of some cancers, and it may prevent osteoporosis in postmenopausal women. Vitamin D may also boost immune function, especially when days are short or exposure to the sun is limited. A dark Canadian winter would surely qualify. As for all the rest of the supplements, you probably don't need them as long as you're eating well. And if you aren't eating well, they probably won't help. I'm Randy Shore for Empowered Health.
Your back affects your daily health. Welcome to another installment of Your Spine, Your Health.
Because you have a spine, it's important to understand what chiropractic care means to your health. Your health always begins with a regulatory college. In this case, the College of Chiropractors of BC serves to ensure you receive appropriate diagnosis and care from a qualified chiropractic doctor today and tomorrow. That's also why BC's chiropractors fund research and education. Today I want to introduce you to Dr. Brian Budgell, who's conducting important research about spinal stenosis.
In general, compression of spinal cords causing a decrease in blood flow is a bad thing. This is most likely the mechanism by which spinal stenosis in humans produces pain and paresthesia, disturbed sensation, and muscle weakness. The acute experiment in animals promises to be able to relieve those symptoms.
Spinal stenosis is a disorder that affects a large portion of the over 60 population. It happens when two vertebrae in a disc start to compress and squeeze the disc against either the spinal cord or the adjacent nerves. This causes a great deal of pain that becomes chronic. It's horrible.
At this moment, however, it's difficult to study the disease because we don't have a good animal model.
This is exactly what Dr. Budgell is in the process of applying to his research, an animal model. A small device is placed at their vertebral column to compress the spinal cord and mimic the disease in humans.
What we have already in the animal is that in the very short term, over a period of minutes, if we compress the animal's spinal cord and decrease the blood flow, which one would think would be bad for a spinal cord. With the stimulation we use, we can bring that blood flow back to the pre-compression level, and we can keep it there so far for the 15 minutes of stimulation. That's the duration that we've chosen to use.
These types of experiments are extremely difficult to perform without animal testing, yet are subject to approval. We do not have the technology to monitor second-by-second blood flow within the spinal cord of human beings.
We're now going in two directions. We want to apply this treatment in the clinic to see if we can make it work in the clinic to help human beings. We also want to do longer-term experiments in animals so that we can understand very precisely the mechanisms of the disease.
As you can see, it's not just about what we can do for you today. We're working to build a better tomorrow through better healthcare outcomes for you. The College of Chiropractors of BC sets the standards for safety, outcomes, and your informed consent.
Today we're going to show you how to perform and progress in the rack pull-up. Because the pull-up exercise is so difficult, you can start slowly progressing by using a squat rack. As we have here, this squat rack has multiple settings. And as you can see, we have set the bar to about hip level on Simona. So Simona, I'm going to get you to kneel down and place your arms on the bar, underneath. So your grip is going to be fairly wide with your palms facing outwards. Your feet are going to be on the ground and your butt lifted off. Keep your core drawn in and your glutes contracted. Next up, you're going to exhale while bringing your chest up to the bar. And lower nice and slow for about a count of 2. Exhale on the way up. Great. Making sure that your arms are in full range of motion. All the way down, all the way up. Good job. Lower nice and slow. As you get stronger, you can start to raise the height of the bar, and eventually you'll be able to do your own body weight.
After the break.
Each company has a different standard of lens within that, so you really got to get educated. And that's where the optician and the optometrist work together, right, to come up with the best game plan for the patient.
Welcome back. We're about to get pretty high-tech in the next 2 segments. First, we're going to learn about 3D dental surgery with Dr. Bahi.
And then we're going to learn about what's cutting edge in lens technology in our ongoing series on the eye. Take a look.
Three-dimensional surgical planning has modernized many aspects of cosmetic and maxillofacial surgery. In maxillofacial surgery, three-dimensional planning is used in areas such as dental implant surgery and trauma reconstruction. Dental implants replace the roots of missing teeth with titanium screws and replaces your teeth with new permanent teeth. The surgery requires extreme accuracy and precision to ensure the teeth are placed in the correct anatomical position. If the dental implants are placed incorrectly, it can be a disaster. The teeth won't work and they look horrible. Today, three-dimensional surgery planning has revolutionized the placement of dental implants. Here we can see the nerve that gives feeling to the lower face. If an implant is placed close to this nerve, the patient will lose feeling in the lower face permanently. This image shows where the underlying bone is located, how thick that bone is, and if it can indeed accommodate the placement of dental implants. If there is not enough bone in a particular area, we know this before any incisions are made to start the surgery. Secondary procedures can then be done, such as bone grafts or sinus lifts, which can be used to rebuild the bone in these areas prior to implant placement. Before the advent of in-office CT scanners, the information for surgical planning was limited and the surgical time was 3 times as long. Now there is no need for incisions to be made, and this allows the surgery to be completed in approximately 1 hour with very limited pain. Another area that three-dimensional surgery is creating a paradigm shift is facial reconstruction. Facial reconstruction is usually required after the patient has undergone a traumatic event. In my role as an oral and maxillofacial surgeon at the Royal Columbian Hospital, I see it all: gunshot wounds, severe beatings, and motor vehicle accidents. These devastating injuries often require complex reconstruction of the face. In order to diagnose, plan, and execute the surgical repair, three-dimensional CT scans are indispensable. From here, I decide how I will approach the reconstruction, which surgical entry approaches will be used, and what final position of the bones will be. If properly planned, the patient will return to their pre-injury state with little or no deficits.
Each company has a different standard of lens within that. It's kind of like when you buy a car, you know, you can get the base entry level, or you can get a high entry level, right, model, and the lenses work the same way. So you really got to get educated, and that's where the optician and the optometrist work together, right, to come up with the best game plan for the patient.
So if all lenses aren't created equal, what exactly should we be looking for when it comes to lens quality?
The quality of the material that's being used, how that material is being cut and made into a frame. Is it being stamped like mass produced, like those over-the-counter readers that people use? That's usually stamped out of a big piece of sheet of plastic. And so that doesn't work so well because it induces a lot of distortion.
While manufacturing and material play a big role in the quality of the lens, there has also been a significant advance in technology that has taken lenses to the next level.
The big advancement in lens technology lately has been digital. Digital is basically how the lens is being cut. It's really a finer way of cutting the lens, so it decreases distortion in the lens, so there's less aberrations in your lens product that you choose.
Taking this technology and tailoring it to each individual and their lifestyle is key to ensuring products work properly.
So those all have different types of designs, right? And so there's ones that give you wider field of view, narrower fields of view, longer corridors, more geared for a computer, or maybe more geared for reading. Now, as the prescription gets more and more complicated, fitting becomes way more important. So progressive lens, fitting the lens is very, very important. Single vision lenses, I guess it wouldn't be as important, but it is very important when we come into measuring the pupil distance, measuring how the frame fits on your face. Depending on what lens you get, there's different grades of lenses. The higher the technology in the lens, the more the fitting of the frame is important. So you have to look at the frame and the lens in conjunction to give you the best vision possible.
Coming up on Empowered Health.
Cinnamon buns for that time when you really want something decadent to have for breakfast.
This cooking and nutrition portion brought to you by Save On Foods.
Registered holistic nutritionist Julia Olton is in the kitchen with me today, and she is going to teach us how to make some amazing cinnamon buns. Once you learn them, you can make them at home yourself. Julia, welcome to the show.
Thank you very much.
Cinnamon buns?
Cinnamon buns for that time when you really want something decadent to have for breakfast. I've gone ahead and mixed the dry ingredients in the mix master here. And now what we're going to do is mix some of the wet ingredients together. Then we add them into here, and this wonderful machine will
mix it all together,
do its magic. So in this bowl we have some butter and water that have been melted in the microwave.
Okay, so these go right in here.
Put that in.
Butter and water.
So next step, we put our milk in. We just mix that up, and we put a little bit of maple syrup in here.
That's again a natural sweetener.
That is. We've got some oil that we're adding in as well. We've got some lemon juice and a little bit of lemon rind.
Nice.
Just to give it a nice little hint of exotic flavor.
That extra kick.
Yes. Yeah. And some vanilla and an egg.
Okay.
So just want to.
Okay.
What we're going to do is add those ingredients to this.
Okay.
And the one thing I wanted to say is that I put it on a little bit before to mix all the dry ingredients together. So they're all mixed and ready to go. And we'll just turn it on, and if you can just pour those things in.
Okay.
So what we're going to do here is just try and make it into as much of a rectangle as possible. And what we're going to do in the meantime here is just make the filling for this. It's got a little bit of butter.
Okay.
We just melted it in the microwave.
Right.
Some cinnamon and some brown sugar. Very, very simple.
Okay, so we already had the brown sugar, just put the cinnamon in.
Yeah, and we just mix this up. Okay, so you just peel your plastic back.
Right.
And then what we do is we spread all of that on the inside. Yeah, you just want to leave a little bit free here so that we can stick it together. I actually end up getting completely involved in moving it around with my fingers just because it's faster. And then what we do is we've still got this plastic here, so we can roll it up this way. This is the easiest way to keep it clean. Your hands aren't getting totally involved.
Right.
And you're just rolling it up. Make sure you seal it here. Right. So when you cut with knives, you're often having to go through and you squish the actual shape of the bun. So just by using a piece of thread.
That's interesting. That is something great. Wow.
And you'll see that it goes right through.
Nicely
and
done,
cuts
Julia.
it. Yeah.
Wow.
Okay, so we've just melted the butter in the microwave there. We're going to add the cream cheese. It's just a couple of tablespoons of cream cheese, so it's not totally out of line. We're going to put some brown sugar in there and make sure everything mixes up together.
Okay.
And then a little bit of vanilla.
Vanilla.
Yeah. So that looks pretty good.
Spread it
so
out.
just spread that out for the whole pan.
Okay.
And grab a bun. They're kind of sticky. We should be able to fit most of them in here, I would think.
Let's see if I can pick one up and bring it around safely. Yes, I did.
There we go.
Okay, now these are going to go in the oven?
Well, I put mine in the oven just because I know there's no draft there. And I have usually turned it on to about 170 degrees for 10 minutes or so, and then I turn it off.
Okay.
And then I put these in there for half an hour and just let them rise.
Julia, time for us to try these?
It's time.
Okay, and I can't wait. I certainly cannot wait. This is my favorite part of the show.
I bet it is. You must taste some interesting things.
Exactly. And this is really tempting.
And they're good 1 or 2 days after.
I'm not going to talk. These are so good. Perfect. This is the best I've had so far.
Well, that's wonderful. And you can think if you're gluten-free, you can eat these in moderation.
Well, thanks for being on the show, Julia, and thank you for teaching us these.
Thank you.
Thank you. On Empowered Health, we always talk about healthy eating. But the truth is that every now and then, all of us indulge, and there's nothing wrong with that. The key thing is to be mindful. To introduce the concept of mindful eating, I've got registered dietitian Melissa LeBlanc with me. Melissa, welcome to the show.
Thank you, Vijay.
So, what is mindful eating?
Well, the concept of being mindful can be applied to many things that we do every day. But more specifically, mindful eating is about being aware in the moment without distraction.
Well, that makes a lot of sense because every time I eat my meals while talking on the phone or if I'm watching TV or reading something, there's a big chance that I'll overeat and afterwards I feel, oh, I've eaten too much.
And that's common if you're paying attention to your activity rather than focusing on your meal. You haven't paid attention to what your body's telling you. So slowing down is key. It actually takes about 20 minutes for your brain to realize that there's food in your tummy once you start eating. So if you eat too fast or you're doing something else, you're much likely to overeat.
Right. So what are the strategies that we can use to make sure that we're taking the time for practicing mindful eating?
So there's lots of things that you can do every day to practice this. And setting some time for a meal is really important. So that 20 minutes or 30 minutes for lunch every day is key. Step away from whatever you're doing at work or any distractions that you might have and sit in a quiet environment where you have less distractions.
And conversations over a meal are fine.
Absolutely. If anything, that helps you to slow down. So one of the things I recommend is taking a pause between bites. So put your fork down, have a conversation with somebody, or sipping on some water. Something else that you can do just before you start to eat, though, is really appreciate the aroma and the look of your meal as well.
Yeah, you know, I mean, I can understand that slowing down helps you plug into your hunger cues again. Thanks for being on the show, Melissa, and sharing this great information with us. Because I think, end of the day, it's not about what you eat, but how you eat.
That's right.
Thank you.
You're welcome.
Well, Vijay, I've got to say, those cinnamon buns looked amazing. I can't believe they were gluten-free.
I certainly couldn't taste the difference, Michelle. To stay updated on everything Empowered Health, be sure to follow us on Twitter.
Thanks for joining us. We'll see you next time.